Welcome to Anuban Pibinwa School. Good afternoon, Pratum 6. Welcome to our online health class. Our topic for today is Unit 1, the importance of internal system inside our body. Lesson 1, the male reproductive system. Vocabulary. The first one is artery. The second one is bleeding. And then circulation and dust. Next, egg and embryo. Next, fatty and fertilization. Next is hygienic mass and sperm. Okay, what is the reproductive system? Our bodies have various organ system which function together for our physical growth and healthy living. If any organs don't work properly, it may affect our health and cause sickness. The importance of the reproductive system. All living things must reproduce to make offspring to keep their species alive, and the human reproductive system is therefore essential for maintaining the human race. So, all the system in our bodies have various organ systems. They will work together, function together for our physical growth and healthy living. So if one organ doesn't work properly, it may affect our health and cause sickness. Okay? Next, parts of the reproductive system. There are two. But we study first the male reproductive system. And this male reproductive system have two systems, the external and internal. Okay? Okay, wait. Okay. External reproductive system. External means outside outside the body. And this is include the penis and the scrotum. We talk about the male, okay? So the external male reproductive system includes the penis and the scrotum. Internal reproductive system is inside the body of the male reproductive system. It includes the testis, epididymis, vas deferens, seminal vesicle, and the prostate gland. And the testes are responsible for producing the male reproductive cells, and this is called sperm. They also produce the male sex hormone, which gives male distinct sexual characteristic from females. So the male reproductive cells called sperm. Okay? Sperm. And it is sperm comes from the testis. Okay. And it also produces the male sex hormone, which gives male distinct sexual characteristics from females. Next, look at this male reproductive system. This is the parts. This one is the scrotum. Scrotum. Okay, inside the scrotum is what we call testis. In plural, because there are two eggs, two eggs, no, two scrotum, it's called testis. This one, this one is the urethra, and this one is the penis. Inside is this one. This is the seminal vesicle, and this brown is a prostate gland, and this small tube connected to the testis is what we call epididymis. Okay. Also this, as you see, this is a front view and this is side view. This one is the vas deferens, and this one, as you see, this brown, and this one is the prostate gland. This one, the tube where your urine comes out, is what we call urethra. And this one inside the scrotum is the testis. And the tube going to this, as you see, this is the scrotum. Then the tube is like this going to the urethra. Okay, is the epididymis. Okay, this is the external and internal male reproductive system. Okay, next. How to keep our reproductive system healthy? There are 7. The first one is do not have sexual relations at school age. Do not have sexual relation at school age, like your age. Okay? Number 2, clean the sexual organs every time when taking a shower and after excretion. Okay? You should clean. This is very important, the word clean with your sexual organs. Every time, not every week, not every month, every time. Okay? When taking a shower. So when you take a shower once a week, you will clean your sexual organ every once a week also. Okay? Number 3, wear clean and dry underwear that is not too tight. Okay? Wear clean and dry. Okay? So every day you will change your underwear, not twice or once a week. Okay. Number 4, do not share underwear or personal items with others. That is most important. Okay? Don't share. It's your uh, own underwear. Don't share to anybody. Number 5, check for any problems with your sexual organs. If any problems are found, you should inform your parents or guardians to take you to see a doctor. Okay. And number 6, when girls have their monthly period, okay, the girls will have their monthly period, they should bring sanitary items and change them every 3 to 4 hours. And number 7, avoid injuries to your sexual organs. Okay, it is very important to keep our reproductive system healthy. Okay, the male reproductive system is mostly located outside of the body, and these external organs include the penis, scrotum, and testicles. And internal organs include the vas deferens, prostate, and urethra. Okay, let's proceed to the main part of male reproductive system. The male reproductive system includes the penis, scrotum, testes, epididymis, vas deferens, prostate, and seminal vesicle. Again, this is 7. The first one penis. Number 2, scrotum. Number 3, testis. Number 4, epididymis. Number 5, vas deferens. And 6, prostate. And 7 is seminal vesicle. Okay, remember that. How does the male reproductive system work? When the erect penis is stimulated, erect penis is stimulated, especially uh, when you wake up in the morning. Okay? Muscle around the reproductive organs contract and force the semen through the duct system and urethra. Semen is pushed out of the male's body through his urethra. Okay? The small tube inside your penis. Okay? And this process is called ejaculation. And each time a guy ejaculates, it contains up to 500 million sperm. Okay. 500 million. So, many sperm. Okay. Every time you process this kind of ejaculation. Okay. What are the 4 problems of the male reproductive system? Number 1, erectile dysfunction. Number 2, premature ejaculation. Okay, this number 1, erectile dysfunction, it will not erect your penis. Okay. Number 2, premature ejaculation, it means you will not uh, experience the ejaculation, or you have many times ejaculate. Okay. And loss of libido. You don't arouse for a girl or a female. Number 4, testicular cancer. Uh, your testis is not normal. They are getting big or getting having pain. That is a testicular cancer. Number 5, prostate disease may cause embarrassment to the patient. Okay. And 6, occasionally the general practitioner. Okay, that is the 4 or problem of the but this is a 6. This 5 and 6 is not it is common. Okay, but this one 4 we need to be careful. Okay, next is where is sperm stored? The sperm stored in the testis, and sperm production in the testis takes place in coiled structure called seminiferous tubules. Along the top of each testicle is the epididymis, and this is a cord-like structure where the sperm matured and are stored. Okay, so where is the sperm stored? It is in testis. Okay. Does one testicle produce male sperm? You have 2 testes. Okay. And the question is, does one testicle produce male sperm? One testicle is usually sufficient to produce semen and testosterone. Okay? Although decreased semen production and quality are often seen with this condition. Okay. So we need 2 testicles because one testicle is usually sufficient to produce semen. Okay, which are the food items that boost sperm count and improve quality. Foods that can boost sperm count, and there are a lot of foods that can boost sperm count, and some of them are listed below. Egg, okay, eggs, peanuts, bananas, maca roots, asparagus, dark chocolate, and walnuts. Okay, these are the foods that can boost sperm count. Okay, eggs, peanuts, bananas, maca roots, asparagus, dark chocolate, and walnuts. Which testis is more important, the left or the right? So many people find that the right testicle is slightly larger and the left hangs lower. Okay? Male, boys, you can take a look with your testes. Okay? You will see if the right testicle is slightly larger and the left hangs lower. So a difference in size is usually nothing to worry about. Okay? If you see that your testis is bigger, the right one is bigger to the left one, or the left hangs lower, don't worry about it. Though it can occasionally indicate a problem. If a testicle is painful or changes shape, a person should see their doctor as soon as possible. Okay. So, if you see that your right is bigger than left and the left hangs lower, usually you're nothing to worry about. But if you feel painful or and then change the shape, you should see your doctor as soon as possible. Okay? Oh, boys, always look at your testes. Okay? If you feel pain and there's something happen or change shape, it's better to look your doctor as soon as possible. Okay? Okay,
The
let's
male
watch
reproductive
this.
system includes the penis, the testes and epididymides held within the scrotum, the vas deferens, and internally, the seminal vesicles and the prostate gland. The penis is the male sex organ. It is made up of the shaft and the head. The head of the penis is covered by a movable piece of skin called the foreskin. The urethra is a tube that runs from the bladder through the prostate gland and the middle of the penis to carry urine out of the body. The penis has a rich blood supply as well as a muscle layer and nerves. When sexually aroused, the blood flow increases and it becomes erect. The testes produce sperm and the hormone testosterone. At the back of each testis is the epididymis, a tube where sperm is stored. When the penis is erect, sperm moves from the epididymis and through the vas deferens to the urethra. The seminal vesicles make a fluid that mixes with sperm in the urethra. The prostate gland is about the size of a walnut. It surrounds the first part of the urethra and adds more fluid to the sperm. During orgasm, the prostate squeezes this fluid into the urethra and out of the body. For more information about cancers that start in the male reproductive system, go to cruk.org/cancer-types.
Okay, so it's very clear. Now, you are going to do page 1 in health worksheet. Okay, when you finish doing that worksheet, you are going to send it to the album. Okay, so thank you and stay safe. Okay, see you next time. Bye.